Good morning and welcome everyone. My name is Nikki Baisa and I am the Regional Care Delivery Compliance Specialist, and I will talk about important concepts of Maui Health System's corporate compliance. Well, I'm quite new to my role, but I'm not a novice in healthcare. I have been a registered nurse for 30 years and have worn many hats. But like some of you, I'm not local from Hawaii. I'm actually from Florida and moved here a few years ago. So, a few months ago, when I came to compliance, they informed me that my first responsibility was to try to learn and be familiar with the many regulations affecting Maui Health System. I was given modules after modules of regulatory standards, policies, procedures, guidelines. So when you hear people say that healthcare industry is highly regulated, I know, and believe me when I tell you that that is an understatement. As you can see with this elaborate framework, Maui Health System, our organization, is highly governed by many federal and state agencies. Examples are Centers for Medicare and Medicaid Services, the DEA or Drug Enforcement Administration, the IRS, Environmental Protection Agency or EPA, the Joint Commission, Federal Bureau of Investigation, OSHA, Food and Drug Administration, Office of the Inspector General, and of course the Supreme Court. And any of these federal and state entities can either shut us down, throw any of us to jail, or ask from us thousands of dollars in fines. So when you start with Maui Health System, we want you to be aware that compliance is really in every thread of our organization. It's in every corner of this place. So, what is compliance? Generally, compliance means following the federal and state laws that govern our organization. It means following policies and procedures, starting from the procedures in your own department up to the policies that affect your role, and knowing the code of conduct of our organization. And it does not stop there. We have to conform and abide by all of these. On the other hand, there is this word called ethics. And we've heard of this before. Example, I'm sure you've heard people say it's not ethical to lie or it's not ethical to talk bad about other people. And another example is this: it is not ethical to take supplies from the hospital and bring it home, right? So, what is ethics? When I think of ethics, I think of those instances when I am at a crossroad and I have to decide what is the right thing to do. Or when I ask myself, am I making the right or wrong decision? So I always imagine the angel and the devil that are on my shoulders whispering, what should I do? For me, being ethical means more than just knowing the difference between right and what's wrong, because knowing what is right is never enough. For me, it means doing the right thing even when no one is watching. So, here at Maui Health System, there are two different kinds of ethics. One is the personal ethics, which governs our moral principles, and the other one is business ethics, which is how we govern and operate our business within the Maui Health System. So, is there a connection between ethics and compliance? Definitely. For our organization to be deemed compliant with all the laws governing us, we have to start by making sure that each and every one of us have good ethical foundation. That you and I, we know what is good and what is right for our patients, their families, our co-workers, our leaders, our hospital, our community. We need to create trust by treating our patients with respect and dignity. Whether you are in the clinical or non clinical area, you are responsible as an employee to make sure you are aware of your own actions. You are the subject matter expert of your own field, and therefore it is expected that you are the main resource of what are the right and wrong standards for your own practice. The Maui Health System's Code of Conduct is like a compass that guides us on how we should behave at work. Whether you are a hands on patient care provider, a clerk, a cook at the cafeteria, a contractor that is involved in a renovation, or even a volunteer, it does not matter where you work or what you do in MHS. Our organization's Code of Conduct applies to each and every one of us because our code of conduct protects our patients and our families by setting minimum standards of practice for all employees. Please know that we have an attestation statement indicating that you are aware of the Maui Health System's code of conduct, and it is done through one of the Relias modules. I want to introduce Vanessa Benavides. She is our Chief Compliance and Privacy Officer of the entire Kaiser enterprise. Please know that MHS is a wholly owned subsidiary of Kaiser Permanente, and therefore our Compliance Officer Amber Bardo independently reports up to Vanessa, although Amber also has a dotted line to our CEO, Mike Rembus. HIPAA, or the Health Insurance Portability and Accountability Act of 1996, is what started healthcare organizations to start focusing on compliance. HIPAA started with laws regulating the transmission of electronic health data. But since then, HIPAA has now evolved to this massive legal entity, and it now regulates privacy and security and enforcement rules. Some examples of HIPAA violation are these. As you know, some of our care providers or healthcare workers have smartphones or tablets, and some of them contain patient information. Now, it will be a violation when those electronic devices get stolen or get lost, or when our emails get hacked, or when some documents with patient health information are found in visitors' bathrooms, or maybe in the cafeteria, or if you use a zip drive and you forgot to keep it in a locked drawer and somebody else found it. What if somebody share username and passwords? Because that's a big no-no in this organization. In fact, it's a big no-no everywhere else. What if instead of the document destruction or shredder bin, you throw away a patient document to the regular trash can? Most of us will have access to Epic or electronic health record. What if you're curious why your friend is in the emergency room and you went ahead and looked at his or her medical record? Or lastly, when you send sensitive information to a non KP or non MHS email address and it contains PHI. Between 2003 and 2009, electronic medical records started replacing paper files. Patients began to communicate with their doctors by email and through online portals. Pharmacies began to process prescriptions electronically. In response to this, HITECH was created to address privacy and security related to the electronic transmission of health information, including unauthorized access and data breaches. The Office of Civil Rights issued the omnibus rule that require organizations like our hospital to protect confidential information. And because you are part of this organization, you are required to report when confidential information is misdirected, lost, or stolen, or if there are any breaches in confidentiality. Some examples of confidential information are social security numbers, clinical and financial data, employee data, and protected health information. Protected health information, or PHI, are identifiable information about our patients' healthcare. And it's not just for the present information, but also refers to the past and future ones of our patients' health records. It can be written, it can be electronic, or in oral forms. Protected health information or any information that may identify or there is enough information to be able to identify an individual. It may be information that is related to healthcare or payment for that healthcare. Now, let's say, for example, you printed an office summary visit and you gave it to one of your patients. Later on, you realized that you gave the wrong document. Personal information are those data that can be used to distinguish an individual's identity. These information can be employment related personal information that our human resources can use for recruitment, for compensation, for benefits, or for performance management. Even business information by Maui Health System cannot be shared with anyone outside of our organization. Know that there will always be consequences for bad actions. When you violate our laws or MHS policies, you may face disciplinary action up to and including termination. This includes accessing information on your family members, your friends, if you access your neighbor's healthcare record, or your coworkers, or even public figures. And sometimes, if you feel like you need to access your own personal health record, think again because that is still a breach of information. So, what can you do to protect confidential information? Here are some steps you can take. Lock your computer when you step away from your workstation. If you are in view of other people, use a privacy screen on your computer. If you are using a removable electronic storage devices like a zip drive or a thumb drive or a DVD, you need to store them in a locked drawer. Please do not share usernames or password. We have document destruction bins everywhere, or these are the shredder bins. Please use them to dispose of PHI. Always report incidents when you come across confidential information where it should not be, like in a copier, or the bathrooms, or the cafeteria, or in the driveway. Please make sure that you do not make scratch papers or confettis out of MHS paper, especially if they have visible PHI on them. You are expected to be able to identify potential fraud, waste, or abuse and take the right action. Our organization can be deemed fraudulent if, for example, we bill for services that were never rendered. Or another example is when we bill for more expensive services or procedures than were actually provided. This is why documentation, whether by physicians or nurses or therapists, are quite important. Because when we do audits, these are the documents that we first look at. Patients can also be guilty of healthcare fraud. Example is identity theft, which is so rampant right now. This is when someone tries to receive medical treatment by posing as someone else, or when they apply for healthcare insurance, they add someone to their policy that is not eligible for coverage. Abuse is committed when one improperly uses hospital resources for personal gain. An example is when somebody tries to use the copier or copy machine to make flyers for your child's school play or soccer game. Another example is when someone uses a company's car for personal use. Waste, on the other hand, is when one is not being mindful of how they use resources. Example, you go to a local store to purchase office supplies instead of using Maui Health System's approved vendors and there are patterns and practices that are highly suspicious of fraud, waste, and abuse. Our role is to look for red flags that may indicate possible wrongdoings. Example, when you see a person checking in without a photo identification, that might be a red flag. Or if the photo ID they're providing you is different than how they look like or different than the insurance card, that's a red flag. Unfortunately, It is our seniors who are oftentimes victims of fraud. Example is Medicare Part D fraud. It is for an example of this is when a pharmacy fills 10 tablets to a Medicare Part D recipient but bills Medicare for 30 or 60 pills. Or when a pharmacy fills a prescription with generic medications but bills Medicare for a more expensive drug. In our workplaces, an example of fraud is when a nurse charts that they gave medication to a patient, but really they're pocketing it. Or when a staff uses company supplies for personal use, such as stealing printer paper, cartridges, or pirating softwares. Fraud in the workplace also occurs when an employee offers discounts or services to their bosses for preferential treatment. So, how can you positively hold yourself accountable? Comply with the regulations and the laws, report any concerns, suspected and or actual violations, and follow the code of conduct. What is conflict of interest? It is when your personal financial interests might influence your ability to make a fair decision on what is best for Maui Health System and the patients we serve. Right from the beginning, you should be open to your manager to avoid future conflict of interest. For example, business ownership. Let's say your sister owns a care home and you refer patients to that specific home care. That's conflict of interest. Some medical devices or pharmaceutical companies offer you gifts or entertainment tickets. That's a conflict of interest. And the best way to do it is do not accept these gifts as if they are for your own gain. Instead, tell your manager, or better yet, refuse or return the gifts. Comply with all these laws and regulations may lead to, unfortunately, termination of Maui Health System's contract with Centers for Medicare and Medicaid Services. Criminal penalties. We may be disallowed to participate in all federal healthcare programs, and of course, thousands, even millions of monetary penalties. Now, for individuals, the disciplinary action for noncompliance may include mandatory training, disciplinary action, termination, or even loss of license. Our goal when there is a major concern in compliance is to resolve the issues efficiently and timely. So, who do you talk to about compliance issues? You can either talk to your manager or your supervisor. You can talk to your local compliance officer or the team, or you can call the compliance hotline. And the biggest question we get asked is this: if you report a compliance issue, are you protected? The answer is a resounding yes. Here at Maui Health, we have a speak up culture. That means that there may never be retaliation when someone speaks up. MHS does not tolerate retaliation. Now, you may also choose to remain anonymous when you call the hotline. You do not have to disclose your name. And if you decided to be anonymous, I can't emphasize the importance of giving the complete detail of your issue. We want to know the what, the where, when, why did this happen, and how did it happen? Or else we might not be able to investigate the issue completely. We want to do our due diligence, but we can only do it with a complete set of facts. Know that after a complaint, we may still need to contact you, so having your contact information will be very valuable. To report compliance issues, you may call us at 1-888-774-9100, or you may contact us through the web. We are available 24 hours a day, 7 days a week. Our role and our accountability as Maui Health System employees are the following. Don't be complacent when you see a possible wrongdoing or a violation of the laws. Abide by the speak up culture of our organization. always protect private information. As an organization, we will always submit accurate records. We will never commit fraudulent, wasteful, and abusive conduct. We will report signs of wrongdoing. We will try to treat each other with dignity and respect. As much as possible, we will try to avoid conflicts of interest, and we will follow all policies and procedures. I want to introduce to you guys our Regional Compliance and Privacy Officer, Amber Barto, and that's her office phone number. And again, in behalf of the Compliance Department, my name is Nikki Baisa, and you may contact me at 808 442 5002. Mahalo.